My name is Richard Resnick. I'm the Vice President of Education at University Health Network and the Chair of the Department of Surgery at the University of Toronto. I'm thrilled today to talk to you a little bit about some of the upcoming changes in education at University Health Network that we're going to be implementing in the next year. Education at University Health Network is taking a giant leap forward. Over the past many years, we have laid significant groundwork to undertake several major initiatives which are coming into play in 2007 and 2008. I'm excited to share these plans with you and to go over some of our projects. First is the work that we're doing in developing and implementing interprofessional education. This concept has been in the lexicon of healthcare professionals for several years, but now the Ontario government and our local education institutions and hospitals are truly embracing the concept. They're supporting the activities and initiatives of interprofessional nature, both in principle and also with financial resources. UHN is positioned to play a central role in making IPE and interprofessional care truly a reality and more than just the buzzword that it was in the past. At present, UHN houses the University of Toronto Office of Interprofessional Education and is supporting and promoting the development of a new initiative called the EPIC Center, or Educating Health Professionals for Interprofessional Care. The EPIC Center will facilitate IPE at all levels of clinical care. In addition, the Center will develop programs to guide health professional students in truly understanding each other's roles in the healthcare setting. This will be achieved by providing education initiatives in a common environment that recognizes the unique abilities and expertise of each of our many health professional groups. Our education role does not only address the needs of health professional students. As leaders in our fields, we have a duty to educate those beyond our walls on topics in which we excel. That is why, and I'm very excited to tell you about this, in 2007, we're opening the Center of Continuing Education and Knowledge Transfer. It is through this structure that we will bring our knowledge and expertise to an international health profession and health services audience. In addition, we will educate less traditional audiences, such as patent professionals, lawyers, business people, financial professionals, who have a vested interest in the various areas of the health sciences. Our goal is to better inform their decision-making within their own professions. We anticipate that this venture will be unique, and we will look forward to sharing its successes. In addition to the Center of Continuing Education, another major project that's underway in 2007 will be the construction of the Paul B. Helliwell Center at Toronto Western Hospital. Like its counterpart at Toronto General, this center was made possible through a generous donation from the Paul B. Helliwell Foundation. It will house medical education and students assigned to the Toronto Western site. We're very fortunate to offer these state-of-the-art facilities to our students, which include examining rooms in which they can practice, seminar rooms, computer laboratories, administrative space, and a student lounge. A key feature of the center is the technology component of the physical examination and seminar rooms. This technology allows the recording of a student while they're performing a physical examination for both teaching and learning, instant storage on an in-house server, and instant retrieval for viewing in exam and seminar rooms. The existing Helliwell Center at the Toronto General Hospital has received rave reviews nationally and internationally. Our students truly are the beneficiaries of this unique learning experience. For the first time in 2006-2007, the leadership at UHN has instituted a balanced scorecard approach to managing and monitoring the activities and initiatives throughout the hospital. Again, in 2007 and 2008, we'll continue to use this tool, and indeed, it'll be fortified. Our education portfolio has set an aggressive but hopefully realistic target to achieve our goals. This year, we will use an expanded set of indicators, including our measures of our education capacity, our measures of education scholarship, what kind of impact we're having in the educational front, how satisfied our trainees are, and how well we're doing in the field of interprofessional education. Like last year, the education team expects to meet or exceed its targets, thereby successfully addressing UHN's education needs. The momentum we're establishing within the education department fuels the educational priorities of our 7 program groupings. This year, we'll be generating a report to illustrate the successes of the program groupings. This report will serve as a tool in profiling the programs and articulating the reasons that healthcare professionals should seek out UHN as a center of learning. This is an important aspect of becoming a real contender in the competitive global market. Among the educational successes of our program groupings are an expanded continuing education activities, numerous educational resources for our patients, students, and other healthcare service providers, and student opportunities, such as new nursing rotations and our expansive fellowship program. Finally, I'm pleased that the Education Intranet has been recently completely redeveloped to better meet the needs of our users. This will be followed later in the year by a redevelopment of our external website. To enhance learning and to improve access to our program and services, a wealth of information is now available. Throughout the year, we'll be adding several features to these sites to make the learning experience at UHN innovative, interactive, informative, and hopefully fun. For me, our education strategy is about fostering an internal culture of lifelong learning at our hospital. Education need not be limited to students and clinical staff. Lifelong learning and teaching are for everyone at UHN.